Following the end of pandemic unemployment benefits, the nationwide September 2021 jobs report showed that the U.S. economy added just 194,000 jobs last month, a figure which fell short of the 500,000 which were projected. California was responsible for creating 44% of those new jobs, but despite adding 104,300 new payroll jobs, California's unemployment rate has remained high at 7.5%. While some employers cite enhanced unemployment benefits as a source of blame for a lack of workers, we are now over a month into the end of pandemic unemployment benefits, and there are many potential causes to explore regarding why Californians are struggling with returning to employment. What is it about California's workers' concerns, labor market, wages, cost of living that is causing the state's problems with workers resuming employment? One factor, which often remains silent in the media, is the psychological effects individuals have experienced as a result of the pandemic. Luana Marquez, a psychologist and professor at Harvard Medical School, states that the pandemic has produced a petri dish of psychological factors that may lead to emotional health problems, anxiety, brain fog, depression, and PTSD. Over a year and a half of lockdowns, loneliness, Zoom calls, grief, illness, monotony, job loss, and economic hardship have caused an extraordinary rise in anxiety and depression. And with the stigma which still surrounds mental health issues, these problems often go unreported by the media. According to the U.S. Census Bureau data collected as a part of the ongoing Household Pulse survey, during the pandemic's first 9 months, 6 times as many American adults reported mental health issues as in early 2019. As of May 2021, the percentage of U.S. residents reporting symptoms of depression or anxiety has declined from 41% down to 30%, but California remains higher than the nationwide percentage, with 33% of California residents reporting depression or anxiety, and many experiencing symptoms go untreated. Financial pressure played a huge role on overall mental health, with lost jobs, increased hunger, and some families facing eviction now that bans are lifted. For those with pre-existing conditions, with difficulty accessing services and increased isolation, mental health has also deteriorated for many with pre-existing conditions. Layers of trauma, anxiety, depression, and a lack of resources or ability to obtain treatment amongst unemployed individuals can complicate the return to the workforce, and due to the stigma still surrounding mental health, this is not discussed often by the media. For those seeking work, they are often told that there are lots of jobs available. California added 104,300 payroll jobs in the month of August, and many companies report that they are struggling to find employees or applicants at all. But there is a fundamental mismatch between what industries have the most job openings now and how many unemployed people used to work in that industry pre-pandemic. For example, there are 1.8 million job openings in professional and business services, and fewer than 925,000 people whose most recent job was in that sector. Leisure and hospitality, as well as resale and wholesale trade, also have more job openings than prior workers. In many cases, job openings with a high number of positions available are in fields requiring a certain level of experience or a specific skill or certification in order to obtain the job. Federal Reserve Chair Jerome Powell put it recently that it has been a vigorous but uneven recovery. The uneven recovery pertains not only to the types of jobs available, but also to the people experiencing the impacts of an inability to return to work. Job losses remain steepest for Black and Hispanic women, as well as Americans without college degrees. Meanwhile, the most urgent need for workers is often in suburban areas where housing costs have skyrocketed, making it difficult for low-wage workers to live there. Which brings us to the next problem, that more than 1 in 3 households in California struggle to meet basic needs. This number is not a figure which is represented in the state's federal poverty level, however. A living wage is the amount of money needed for a worker and their family to cover the cost of their minimum needs where they live. Currently, the federal poverty measure puts California's poverty rate at 11.4%, but this fails to take into account regional cost of housing, food, medical care, and transportation. The United Ways of California, an anti-poverty advocacy organization, shows that the rising costs of housing and childcare have offset the increase in wages over time, so much so that 3.5 million working households don't make enough to meet their most basic needs: food, housing, healthcare, childcare, transportation, and essentials. The report found that 97% of struggling households have at least one adult working full-time, suggesting that the problem is jobs in California are not paying a high enough wage to cover the basic cost of living in the state of California. A calculator tool created by the United Ways incorporates census data to calculate the amount of income needed to sustain a person or family, incorporating details such as number of ages of the family members and adjustments to cost of living based on county. A family of 4 in Los Angeles County would need a minimum of $95,112 in order to make ends meet, according to the calculator. The current minimum wage is $14 per hour in California for all employers with 26 or more employees. That means that if a family of 4 has 2 working adults at minimum wage, they would earn $53,760 per year in total. But the mean hourly wage in Los Angeles County is $30.61, which would translate to an annual income of $117,542 in a household with 2 working adults, which would potentially cover the cost of living at its minimum. But what about those who work in industries which earn less than the average wage for the county? Those working in healthcare support, food preparation and food service, cleaning and maintenance, personal care and service, office and administrative, farming, fishing, and forestry all earn wages significantly below this average. For example, someone in healthcare support, an essential worker vital to our community, would on average earn $16.44 per hour, which translates to just $63,129.60 per year in a household with 2 working adults, which is far below the amount needed in order to cover their cost of living in the state of California. For some, they may have been able to locate a suitable job and return to work. For others, they may have found and accepted work, but it is not a job which will sustain their cost of living in the state of California. Others may find that they are undergoing a shift altogether in the type of work they seek out and are undergoing a change in how they earn income, with some changing industries or seeking to become self-employed, and others may have their return to work be impacted by other effects of the pandemic, fears surrounding the health of themselves or their loved ones, logistical challenges, and mental health changes as a result of many layers of effects from the last year and a half. So, what is next for someone finding themselves lost in their return to work? First, some may need to take care of themselves on the most basic levels first to ensure that their needs are met. Applying to California's aid programs, such as CalFresh for food, rental relief to pay housing and utility bills, enrolling in the subsidized health care for as little as $1 a month on Covered California are the first steps. Those struggling with mental health issues can find a registry of facilities, hotlines, and community programs at 211.org. Second, is finding work. For those who seek out remote positions, I have compiled a resource of remote job websites as a starting point. For those who are looking for in-person work, popular job search websites include Indeed, Glassdoor, CalJobs, and ZipRecruiter. Free job counseling and guidance is available at the Job Centers of America at careeronestop.org. Some may want to take into consideration the fields offering the most job openings and keep in mind the minimum amount of income estimated in order to make ends meet in their county, and weigh it as a factor when considering certain industries, jobs, or places to live. Third, some may wish to decide to try to create an additional stream of income through self-employment, to shift how they earn money or diversify their income. Self-employment is challenging and comes with overhead, taxes, and many challenges, and businesses do have the potential to lose money in their first year due to high setup costs, but for some, they may wish to pursue creating streams of income which are not controlled by an employer and can be worked on while you search for work, in some cases operate as a stream of passive income on the side, or if it grows to the same level, even replace your employment altogether. Many resources are available on my channel homepage about starting a business in the state of California. Regardless of your own personal unique situation, whether you are an employer struggling to keep your business open due to staffing shortages, someone struggling with the many effects that the last year and a half has had on their mental health, an unemployed worker struggling to locate a job which matches your skill set and which pays a living wage high enough for the state of California, or if you are someone who has recently returned to work and are adjusting to the new job, one thing is certain, that the last year and a half has been anything but easy.